start.
Okay. Hi, good afternoon, everyone. My name is Jim. Yes. Yeah, today I'd like to share the topic on so-called the milk production system on the prostate organ, and to see how Ganoderma can use as a supplement treatment to this disease, prostate diseases. Next. Okay, first we go for the disclaimer. All the information contained in the slide are intended for general health information and educational purposes only and are not intended to be used as a substitute for professional medical advice, treatment, or care. Yep. Okay, first, before we start, we actually look at the statistic for prostate cancer. Okay, based on the WHO data in 2018, prostate cancer is the fourth most common cancer. Okay, as you look at on the right one, on the right top right, they see 2.1 million on lung cancer, 2.1 for female cancers, breast cancer is next, and followed by colorectal cancer. I see the fourth one will be prostate cancer, 1.3 million. So you can see back in 2018, there are 1.3 million new cases globally. As in Singapore, the data from SingHealth, the 5-year data 2013 to 2017, okay, it is the third most common cancer for men. And the first one is lung cancer, 14.5%. Sorry, the first one is colorectal cancer, 16.8%. Second is lung cancer, 14.5%. And prostate is 14%. This is mainly for men data. Next. So, yeah, now we look at the first disease, which is enlarged prostate. And enlarged prostate is also known as benign prostatic hyperplasia, which is in short called BPH. The other term also they look at is a lower urinary tract syndrome, which is LUTS. This is not a cancer, but it's kind of a, they actually grow bigger, and it does not raise the risk for prostate cancer. As you look at the left picture, for a normal prostate, okay, below the bladder, just below a bladder, the tube that actually connecting the bladder, they actually pass the liquid waste toxic through this tube. Okay, another normal case, you can actually pass out urine easily. But when the prostate grow bigger, they actually blockade the tube. Then you have problem passing out the urine. That's where the bladder have full of those liquid toxin stay there. And the actual cause of this prostate enlargement is unknown, okay, at this point of time. But the risk factor, they actually, researcher found that it's due to aging. Okay, but why aging can cause this problem? Because for men, aging, there's a change in the hormone. So they actually believe that could be the problem because of when you age older, hormone change, and this will cause the prostate to change accordingly. So more than 90% of the men aged above 80 have this type of condition. Another thing is that it's not aging, but it's obesity. So obesity also can have the higher risk on getting this prostate grow. And the size, the normal size of the prostate is a size of walnut, but when you grow, it can actually grow very big, like an orange size. Next. Yeah, next we look at the other one is the second one, which is a prostatitis. This is in fact inflammation on the prostate gland, and often causes by the painful and difficult urination. And it starts only when bacteria in the urine leak into the prostate. So this one can be actually caused by number of different things. Okay, sexual disease and all this, but mainly because due to virus or due to bacteria. And if it's caused by a bacterial infection, actually it can be treated with antibiotic. it can be treated quite successful with antibiotic. So depending on the cause, prostatitis, this inflammation may actually come on gradually or suddenly. Okay, and it may actually get better quickly, either on its own or with treatment. So because this is due to infection. So sometimes prostatitis lasts for months or more, or keep recurring. So it becomes a chronic problem. Yeah. Next. The last one we look at is the prostate cancer. So what is prostate cancer? So when cells in the prostate grow and it multiply uncontrollably to form a lump, and it actually grows out of prostate and invade the surrounding tissues. So eventually these cancer cells spread to lymph nodes, skeletal bones, and other regions of the body. Study has shown that many elderly men actually have this small prostate cancer, which do not cause any symptom at all. And at the early stage, they do not feel anything. So that's why they may not need to be treated. Okay, but the risk factor here is actually come from the inflammation. If you don't treat it, it can actually become a problem for this so-called become a prostate cancer, because it actually become infected. So another risk factor is a family history or gene mutation. Okay, obesity is also another one, and diet is also another factor. So if you look, sorry. Yeah. So for next, we look at the symptom for this prostate disease. So these are the common symptoms. So mainly involve the urination. Okay, increased frequency of urination at night, or there's a frequent or urgent need that you go for urine. Urinary hesitancy means you have trouble in starting or maintaining the urine flow. So it becomes start and stop. Okay, it's not a continuous flow. And when you want to urine, then you have difficulty in starting the urination. So it could be a problem. And weak urine stream, or a stream that starts stop. Just now I mentioned the flow is not continuously. Okay, and sometimes the urine is actually stopped, but actually there is some more urine that actually you want to pass out. The other one will be painful when you pass out urine. At the same time, you actually feel a bit, occasionally you feel lower back pain. And the worst one is that you have fever. So this is the obvious, it's quite a very likely that you have prostatitis, which means you have inflammation on the prostate. Okay, and may not have obvious symptom in the early cancer stage. This is the so-called quite a normal one, because when the cancer actually tumor start very small, you don't feel to have any impact on or difficulty or any problem in terms of passing urine or any other symptom that you actually experience just now we have said. So in early cancer stage, normally you don't actually notice it, okay, because they don't have symptom. And next we look at less common symptoms, which is a UTI, urinary tract infection. And then the other one will be inability to urinate. Then the last one will be the one you probably quite severe, is that you have blood in your urine and semen. This one normally you will actually know it, yeah, but it's a less common symptom. Next. Condition that can lead to the same symptom as well, okay? UTI, just now I mentioned, or narrowing of the uterine tube. So this uterus is just now mentioned is that actually it's a tube that connecting to the bladder, from the bladder to pass out all the so-called toxin waste as urine. And scarring in the bladder neck as a result of because of previous surgery. So this one could actually having the same condition, the condition that lead to a similar symptom. Or you have or we have bladder or kidney stones. Problem with nerve that control the bladder, and cancer of the bladder. So once patient notice that you have all these symptoms, actually you should consult the urologist. Okay. for more further investigation. Yeah, next. Okay, how to prevent? Okay, the prevention for this so-called is quite a general one. Okay, it's very common for everybody. Is that eat healthy. For every disease, I think before it happens, I think the first thing that we actually advise is that eat healthy, eat a balanced diet. The next one will be move more. Move more means that you can exercise regularly. The other one will be smoking, okay, and also get regular checkup. So for diet, it's actually advisable to have less so-called red meat. Okay, take more vegetable. Yeah. Next. Okay, for the diagnose itself is that first they have this so-called the symptom chart. Okay, symptom chart is that actually there are 7 questions that actually ask patient about how often they pass out urine, whether they have pass out urine at night, how frequent they actually go to toilet after 2 hours and all this. So it's a 7 standard question that this is they call IPSS, which is a international prostate symptom score. So they will actually have this, and then they will actually ask you what is your every row. They will ask you the frequency, the numbers, and followed by they will ask you. And one more thing is that the quality of life, how does it affect with all these problems? So with all this score, they actually come out a numbers. So all this score you just add together, they will come out a number. So they will actually use it to monitor the so-called the condition. At the same time, also to see whether the treatment, how well we respond to a treatment. Okay. So the next one is actually using the Euroflowmetry. This is actually a device that actually let the male patient to pass out urine into this device that allow for measurement to determine the urine flow rate. So this is actually a very first so-called the diagnose, okay, before they go for further check. Yeah. So the next once actually you have gone through all this so-called just now the IPSS and possibility the so-called the flow rate check. If they found that they need further investigation, whether screening, they actually go for a blood test on PSA. So and then the next one will be a digital rectum examine. Okay. So for PSA is just a so-called a marker test. So this marker actually will determine whether you got infection or inflammation, or when the numbers go higher means that it's no good. So the normal one will be 0 to 4 milligram per milligram per milliliter. Yes, the next one, once they find that they want to know, okay, understand whether the condition can get, is it true that they have some growth of a so-called tumor, they actually go for the digital rectum examine. Okay, so they will actually, the doctor will actually ask you to bend down, actually poke the finger through the anums to actually feel it over there, feel the so-called the area that to see whether the prostate grow into a size that they can feel it. So if they find that there really is evidence that there's a growing tumor over that area, or there's a growing so-called lump over there, they actually ask for further diagnosis. They will actually send for ultrasound, RMI, or some biopsies to actually confirm that whether the tumor, the growing area, the tumor, is it cancerous or so-called is it a cancer tumor? So once they found that, okay, you have, from the biopsies, they determine that if you have this cancerous tumor, they actually go for further tests to determine whether the cancer has spread. So the first thing they will go, there is a bone, they can actually go for bone scan, because when you spread the nearer area that is spread, normally you have the bone area will be spread too. Okay, Then they'll use ultrasound to go for further investigation, and CT scan, MRI scan, and PET scan. Yeah. So these are the diagnostic so-called tools that they'll be using and the step they'll be going through. Next. Yeah, now we look at the stage of the cancer. For stage 1, it's normally still localized and very small. Okay, so within the prostate. For stage 2, actually it's more advanced. Actually, they actually grow bigger, but it's still within the prostate area. Okay, as you can see on the picture on the right, the stage 1 is very, very small. Okay, so in the early stage, there is no symptom. That's why it don't seem to have any problem at all. But stage 2, you can see that it actually start growing. Okay, stage 3 actually already spread to outer tissue of the prostate. Okay, actually I can see it grow bigger. So for stage 4, actually cancer has spread to a distant organ. Okay, out of the prostate area. Yeah, next. As for the treatment, so here the treatment, now we look at the treatment type for this enlarged prostate, which is an BP treatment type for BPH and LUTS. So the current treatment for this BPH range from a lifestyle modification to oral medication and surgery. So oral, they actually give so-called when you are early prostate obstruction, then they'll give a alpha blocker, okay, which actually act on the receptor in the bladder neck. So actually they are actually these so-called drugs actually relax, okay, the muscle of the bladder neck, so that the urine can actually pass out through the very tiny tube, because it's already enlarged. So the tiny tube is very small. So so without this drug, is that when you actually pass out urine, the pressure over that small little tube is quite huge. That's why you have pain. Yeah. So this drug is actually relax the muscle over that area, the bladder neck to the tube. And when the prostate actually grow bigger, more than 40 milligram, they use another drug, 5-ARI, which is act as inhibiting the growth of the cell within the prostate. You mean they actually inhibiting the cell growth for the prostate. And actually, this will be actually taking over a period of time, and it will actually help to actually reduce the prostate size. Yeah. Next will be actually a surgery, which use a special device actually go through the so-called the penis, and from there they actually do the so-called the surgery on the prostate to reduce the size. Yeah. At the same time, also reduce the blockage. That will actually indirectly reduce the blockage of the so-called the tube. And the last one will be the laser therapy. Yeah. Next. So this following on the treatment, common treatment for cancer. So the first one will be surgery. So for surgery, when it's localized, they actually can cut off, they remove it, so they can increase the surviving rate. Okay. And the next one will be chemotherapy. Actually, they're using drug and medicine to treat the cancer. So this one will kill the cancer that spread, but actually normal cell will be affected also. Okay, then you will have a bone marrow suppression side effect, and the rest of other side effect. The next one will be radiation therapy. So this one is using a high energy particle to actually destroy or damage the cancer cell. So radiation, it just treat the tumor itself, and it's more localized. Okay, but the drawback will be the fatigue and skin changes, and probably side effect on the appetite loss. The last one will be targeted therapy, probably on the on the so-called hormone therapy or targeted therapy. So they use a drug to actually more precisely identify and attack the cancer cell. But this one will be little damage to the normal cell, but new drug can be quite costly. Okay, but it actually carries some side effect as well. Now we look at the consumption of health food. Okay, a good number of health food that actually can lay a foundation to control the growth of cancer cell due to the ability in regulating our physical constitution and immunity. Okay, Lingzhi and also so-called Ganoderma has been regarded as a top-grade health food in enhancing health due to the pharmacological property for this therapeutic effect as well. Next. Okay, Ganoderma, also known as Lingzhi, is type of mushroom, okay, and or fungus that has the healing property. So the healing property also include the therapeutic effect. So this so-called Lingzhi has been documented in the so-called 2,000 years ago in the Shenlong 本草经 and 本草纲目, the oldest medical book in China. And the documented insight was actually mentioned as for this Lingzhi, consistent and long-term consumption of this Lingzhi actually help to regulate and rejuvenate your body function. Hence, it actually slow down the speed of aging and prolong one's life and improve the quality of life. And only come to recent 50 years, there are more scientists and researchers that interested in so-called the therapeutic effect and their properties. Then they have done a lot of modern research on this so-called Lingzhi. So there are more than 1,000 research result. Okay, you can actually find Google in this PubMed so-called database. Yeah. Yeah, next. Ganoderma on cancer treatment, supplement treatment. As our body actually consists of many organs, and all these are with different systems. So Lingzhi itself is actually good for the whole system, from nervous system, circulatory system, digestive system, and respiratory system, immune system, and the endocrine system. All these have benefit to all these systems due to the function, because Lingzhi itself, they actually can regulate immune system. There are 4 things that Lingzhi do: regulate immune system, improve blood circulation, enhance the liver function, and remove free radical and antioxidation. Due to the 2 major components in it, which is terpenoid and micromolecular polysaccharide. Yeah. Yeah, next. Ganoderma assists in cancer treatment. Actually, Ganoderma in the cancer treatment, they are actually come in 2 approach. The first is to prevent the cancer cell from proliferation or metastasis. So this metastasis means it's actually spread. And first thing they do is they actually prevent it from growing, is that by induced apoptosis and kill the cancer cell directly. So apoptosis is a situation where a normal cell, okay, when they grow to mature cell, they actually do a cell division. So this so-called the new division cell will actually continue to live, but actually the older cell, the mature cell, will actually replaced by this new cell. So for a normal cell to function, the cell cycle is actually grow this way as normally. But for cancer cell, it's different. Cancer cell, they actually behave like this, but they won't die eventually. They keep so-called multiplying. That's why this Lingzhi can actually help to induce apoptosis to actually make them stop from producing after the division and then stop growing. So with that, actually it increase the patient's surviving rate. So the next approach is that they actually complement treatment to chemotherapy and radiotherapy. What it means is actually during this chemo and radiotherapy actually help to reduce the side effect. How they do it is by antioxidation and stimulating the mechanism such as bone marrow suppression because of the chemo, and also provide liver protection. Yeah. So so all these are evidence-based research that have been done on this Lingzhi and on cancer treatment is actually documented in the so-called the PubMed. And this PubMed is because a lot of researchers interested in so-called this Lingzhi effect on cancer treatment. And currently there are close to about 1,000 publications on Ganoderma and cancer published in the PubMed. And PubMed is a repository database for from the US. It is US National Library of Medicine National Institute of Health. So for those who are interested, can actually Google and find it from there. Yeah. Yeah, next. Here are the example. There are a few example of the so-called the research and technical paper that on the prevention of cancer cell proliferation and metastasis. So these are the research done on the so-called the with the in vivo test on animal. So they're actually using the so-called terpenoid component research on these animal cell, that animal that has a cancer tumor cell. So in summary, that they have a so-called terpenoid inhibit new vessel formation in a direct manner, meaning that how they actually stop the cancer cell from actually forming or growing is actually stop using the so-called the terpenoid to actually stop the cancer cell from growing um, from the new vessel, the blood vessel. Okay, our normal cell actually need nutrient, so they actually grow. So this so-called grow, they will need, they actually have a new blood vessel to form. This blood vessel actually is actually require to transport the nutrient or the nutrition to feed the cell. So for this so-called cancer cell, they also behave the same. They actually grow new vessel. So once they grow, they keep multiply and then keep actually take away all the nutrient from our body. So tretopenia have this effect to actually stop this new vessel formation in a direct manner. So when you stop this new vessel form, the actually cancer cell will not grow further. Yeah. So the tretopenia have this ability. Next, we look at the polysaccharide. Polysaccharide has the other effect. Okay, the effect is indirect manner. What they do is actually they actually train our immune system. So once you train our immune system will actually able to actually identify those cancer cells and then also do the same function as inhibit new vessel formation. But this is in a indirect manner. Yeah. So through all this research, they actually suggest that high dose have prominent effect on the tumor tissue inhibition. Yeah. Next. Next is on the research and clinical trial. So this is actually the clinical trial on the actual cancer patient. They actually use Ganoderma to actually give supplement treatment to this cancer patient. Okay, so in summary, that they actually found that Ganoderma actually modulate the patient overall immune system, and it actually able to enhance their body anti-cancer ability and raise their tolerance to chemotherapy and radiotherapy, which actually reduce their side effect as well. So what they have done is that actually from this research, they found that they actually give the purified polysaccharide dose of 5.4 grams. So this is actually so-called the polysaccharide itself, and they actually give at least 3 months, okay, for a period of 3 months to see this so-called the good effect. Yeah, next. Next will be Ganoderma Research on Prostate Diseases. So Lingzhi terpenoid on prostate problem. So first we look at the first problem on the prostate is that the bladder BOO, bladder outlet obstruction. So for this, they actually divide 50 patients. They actually have a group of patients. They age 50, around 50, okay, average age 50. So they are, just now we mentioned about the IPSS score. Actually, they get this this so-called group that has an IPSS score greater or equal to 8. So minimum is 8. Okay, and the PSA, so the blood test PSA is less than 4 nanogram per milliliter. They actually randomly assign them to 4 groups, okay, using the double-blind method. So there are 4 groups. So the first group is that they don't do anything, they don't take anything, okay, for 8 weeks. They monitor for 8 weeks. The first group is don't take anything. Second group, they take Lingzhi extract for a certain dose, is 0.6 milligram per day, okay, for 8 weeks. The third group is 6 milligram, okay, the last group is 60. Okay, so the result came out is that those taking Lingzhi extract more than 6 milligram is able to help patients actually reduce their IPSS score. So this IPSS also have a section that quality of life improve. Yeah. So next we look at the LUTS, lower urinary tract system patient. So they also do the same experiment. They divide 88. Now they take this group is that slightly moderate LUTS patient. Their average age is about 49. So there are 88 patients. Average age is 49. So their score for the IPSS they randomly about 5.2 to 13.8. Okay. So their PSA is about 0.4. So they split this group 88 patients into 2 groups. So they actually monitor them for 12 weeks. So don't take anything one for 12 weeks. The other one take Lingzhi for extract for 6 milligram per day for 12 weeks. The result came out is that they are able to help patients actually reduce their IPSS score. At the same time, they improve the quality of life, yeah, by 2.1. Yeah, next. So the last one is also on Lingzhi, caterpillar on a prostate problem. This one they get 50 patients. Okay, average age is about 50, and their IPSS score is above 5, and the PSA is less than 4, so which is a normal one. Okay, into 4 groups, randomly divided into 4 groups. The first one is don't take anything, also monitor for 8 weeks, and take Lingzhi 0.6, followed by third group is 6, and the last group is 60 milligram. So all these monitor for 8 weeks. Okay, the result came back is that taking Lingzhi extract more than 6 milligram is able to help patients reduce their IPSS score. So actually, how they monitor is that they actually, before they start this experiment, they actually have the IPSS score, okay? And scoring, they already have the number. So every week, they actually do the monitoring based on IPSS score. So every 4 weeks, they take one. Then 8 weeks, okay, they take one. So below, there are 2 charts. On the left is on the 4 weeks. On the right side of the chart is on the 8 weeks. As you can see, the lower the so-called the bar chart, the better. So on the last column, you can see that those taking 60 milligram, you can see have a great so-called reduction on the IPSS score. Yeah. Yes. Yeah. Next. So next we talk about the Ganoderma Research on prostate cancer. So this is the so-called the technical research on the using the GLP, Ganoderma lucidum polysaccharide, inhibit the prostate cancer cell migration. Okay, so what they did the experiment is that they actually have all these polysaccharide, okay, done in the so-called the in vitro, okay, on the cancer cell itself. So they actually found that the GLP was effective in actually inhibiting the cell growth, and the cell cycle also affected, and the cell migration, and the suppressing effect is there, okay, of the cell migration. Okay, sorry, the suppressing effect on the GLP on cell migration may occur via the so-called PRMT6 signaling pathway. This is another area that this can actually stop the signal path from spreading for the cancer cell. So actually cancer cell, when they actually spread, they need a signal path. So when this signal path being blocked, they are actually no longer able to actually spread further. So this so-called study have found that polysaccharide have this effect of not only stopping the cell from growing, but actually can actually stop the so-called cancer cell from going further because of the signal way being blocked. Yeah. So the conclusion is that the GLP may act as a tumor suppressor with application in the treatment of prostate cancer. Yeah. Next. Yeah, now we look at the Shuang product. So Double Crane is in the name, the company name in Taiwan, and Shuang is in Singapore and Malaysia. So this company is back. It has more than 30 years in research and development, and the core product is Ganoderma, Lingzhi. And their supply chain, actually they control their own supply chain from farming, from development, farming, production, and distribution. So quality control can be actually made consistent throughout the years. Yeah. So the Ganoderma product with so-called rich tretophenol and micromolecule polysaccharide content, which is the key so-called unique selling point for this so-called Ganoderma product. And this product has been scientifically certified with government endorsement. Yeah. Yes. Next. Okay, next we're talking about this so-called recommended dosage. So this is the dosage actually based on the many years of experience from the leaders that actually who had very good knowledge of this so-called Lingzhi. That's why they have compiled this dosage plan for us to use as a guide. Okay, on the so-called vertical left side axis, there is a daily dosage numbers, and on the so-called y-axis on the bottom, that is the period. Okay, so the first one, we look at the left side, the prevention. So for prevention means that you can actually have a dosage of 12 YK1. Okay, but when you actually go to a complement treatment, for example, now you are under the so-called cancer treatment, you can actually have the dosage of 60 YK1, or alternatively, you can actually take YK2 for 10 pieces per day. So what's the difference between YK1 and YK2? Okay, YK1 in general is that 6 YK1 is equivalent to 1 YK2. Yeah. Okay. Now we move on. If you have cancer stage 1, 2, 3, 4. For cancer stage 1 and 2, probably that will be recommended for 30 YK1. Alternative will be 5 YK2. And for stage 3 and 4, cancer stage 3 and 4, it will be minimum 120 YK1 per day. Alternative will be minimum 20 YK2 per day. Yeah. So for once you have once the cancer remission, okay, for the first year, minimum for maintenance, minimum will be 30 YK1 for first year. And come to second year or third year, you can actually reduce down to 20 YK1. And you go further, fourth year onward, you can actually take 15 YK1. And after 5 years, everything settled down, then you can actually maintain it as 12 YK1, which is equivalent to your previous stage of prevention, 12 YK1. So at this point, you actually can be a good news that you actually beat the cancer. The cancer does not actually here anymore, but for maintenance, it's good to continue with a 12 YK1. Yeah. So now we look at the testimonial. A first testimonial is was the case of a prostate gland enlargement. Okay, this Mr. Xie, actually at that time back in 2012, age 85. Okay, so on about 7 years from 2012, which is 31st July 2005. At that time, he was 78 years old and has a sudden loss of appetite and do not able to urine for a whole day. So he feel very painful and the blood actually bleed, okay, from his anus, and he passed out urine also has blood. So went to a doctor and see, and then found that there is a so-called the bladder enlargement, okay, and by at that time a surgery is required, so that but the problem is that he was too weak for the surgery, so doctor actually want him to actually stay back in the hospital to do observation and wait until the so-called the body is ready for fit for the surgery. And the family actually found that Lingzhi is good through a friend, and recommend actually let him take Lingzhi, okay, start the Lingzhi YK1 for 5 capsules per day, followed by I think he take YK1 5 capsule, pollen 10 capsule, and protein 2 sachet for 3 times before meal, okay, every day. So I've been taking since the first day. So on the day 5, okay, he was certified by doctor to be fit for surgery. So the family was very happy, okay. After the surgery, the dosage actually increased to YK1 6 capsule, pollen 12, and protein 2. Yeah, actually, pollen actually is a 2 times the YK dosage. So they also take the same for 3 times before meal. So initially when he so after the surgery, everything went well, on track for so-called recovery. So after that discharge, he went for the so-called weekly review. Everything was on track, okay, very good. And 3 months after the surgery, doctor was surprised that the PSA, actually the so-called the blood test for the PSA, is also dropping back to normal, and the high blood pressure and the so-called the sugar level also back to normal. Previously, he has a high blood pressure reading was actually way above the limit, same as a glucose level. So the family was quite happy, very happy. So now he still continue the Lingzhi and pollen in the morning every day for the health maintenance. Yeah. So this first testimonial. Next. Okay, second testimonial. So this is the case of prostate enlargement and cancer. So back in 2012, Mr. Lim, also from Taiwan, age 70. So 1 year from 2012 is October 2011. The patient, the so-called Mr. Lim, actually he complained to his family member that he always need to wake up at night to urine, okay, and then for a few times at night. So actually affect his sleep. So quality of life also affected. So his wife went accompany him to see doctor, and then found that, oh, he got prostate enlargement, and also later found to be a prostate cancer. And his PSA reading was at that time was 194, okay, nanogram per milliliter. So for normal reading range, it's supposed to be 5.8 to 6.5 at his age group, 70 to 79 years old. So doctor actually went for further investigation using CT scan. That he had stage 4 prostate cancer. Yeah. So he's not able, since it's stage 4, okay, doctor is not able to actually do any surgery. So the thing that he can actually go for is hormone treatment. Yeah. So the doctor knew someone who had taken Lingzhi and know that it's very good, okay, and she let her father take this 12 package. At that time in Taiwan is 12 package of Lingzhi, what I guess is YK1 plus YK2 8 capsule, and together with pollen 12 pollen per day. Actually, it's a 4 times per day. Okay, split into 4 times per day. So after 4th day, he's actually, after taking this Lingzhi, so-called this dosage plan for 4 days, the PSA actually dropped to 124. So they were very happy. After 4 months, they continue to take this dosage. Okay. After 4 months of this Lingzhi so-called dosage plan, and together with the so-called Western drug hormone injection every month, he actually see the so-called PSA drop to 2 nanogram per milliliter after 4 months. So after this incident, Mr. Lin became more conscious about life, and he started to go for, slow walk, to actually do exercise every morning. Yeah. So the diet also changed to less salt and less oil. Yeah. So for maintenance, actually he had reduced the dosage plan to 2 times a day for the same dosage. Yeah. Yeah. Okay. Shuang also have other supplement product, Yongjian pollen. So Yongjian pollen is the most complete food on earth, which has more than 200 plus of nutrients. Okay, more than 16 vitamins, more than 16 minerals, and 21 amino acids, and 28 nucleic acid, and more than 94 enzyme and coenzyme. So all these nutrients are actually have the function and benefit on regulate our nutritional imbalance, calm our nerve, and relieve stress, and help in weight loss. So for this prostate, one of the so-called risk factor is also obesity. So this one does help in controlling your weight. And then your energy level also increase because of increased stamina and remove the fatigue. Yeah, as J.H.O mentioned on the so-called testimonial, the so-called Mr. Xie, okay, taking pollen to actually improve the fitness so that he can go for the surgery. Yeah. So the last one will be enhanced absorption of the Ganoderma. So that help when you're taking together with Ganoderma. Next. Another product is W.H.O instant protein powder. Yeah, so this protein powder, there is a unique component, isoflavones, which is a unique group of so-called phytoestrogen in plant. So this one can subdue growth of tumor cell and preventing cancerous disease, according to a study. Okay, some research found that, yeah, actually for this, they look similar to a female sex organ estrogen, and it acts like a so-called weak estrogen. So this estrogen is actually for breast cancer. If you are too strong, okay, this will actually have a problem on that. So once you take this so-called the isoflavone, the so-called the protein powder, it provides a weak estrogen. So this weak estrogen actually able to actually hook up to the receptor. So once this so-called the receptor actually being occupied by this weak estrogen, okay, then there is no more space for this so-called strong estrogen. So actually indirectly will actually reduce so-called the risk of the breast cancer. Yeah. Next. Soya food and cancer prevention. So this protein powder is kind of soya bean, okay, and they have anti-carcinogen. It actually help to lower our risk of cancer. So according to some statistic, they found that the country that actually consuming soya food actually have less breast cancer. Okay, so as you look at the China, yeah, the average person, if you take 9.3, they actually breast cancer rate, actually they saw that there is a lower risk, 4.7, okay, as compared to United States. Yeah. So people consuming soya food have less cancer. So for example, in Singapore, study in Singapore, there are 55% lower breast cancer risk for those who take soya food. So for prostate cancer, okay, there's a study in Hawaii. They found that tofu diet, they have most protective on this prevention and lower the risk of prostate cancer. Yeah, next. Okay, conclusion. So cancer is still one of the most dreaded diseases, and Ganoderma is one of the best health food to actually prevent, also complement treatment on cancer. Ganoderma enhance our body immune system, and use of Ganoderma together with surgical removal, chemotherapy, and radiotherapy, in fact, is effective in improving the condition, as shown in just now the testimonial together with the so-called the research paper. Yeah. And other Shuang product like bee pollen, protein powder can also be part of the treatment plan together with the so-called healthy diet formula. Yeah. Okay. Yeah. So that's all for me. Yeah. Thank you everyone. Thanks.